name is Paisley. I'm a naturopathic physician. I've been practicing here at Nature Cures Clinic for just under 8 years now. I'm a graduate of National College of Naturopathic Medicine, which is here in Portland, Oregon. I graduated with a doctorate in naturopathic medicine. At Nature Cures Clinic, I've been practicing primary care medicine, treating men, women, and children with the whole spectrum of healthcare needs, wellness exams, physicals, gynecology, managing chronic and acute illness. Currently, my practice is moving into a consultation-based practice. The service is intended to meet people who don't have access to naturopathic medicine in their town or are wanting to explore what naturopathic medicine is all about somewhat from a distance. This is great for any patient who doesn't have access to healthcare in their area or does and just wants to kind of get introduced. Primarily, I will not be necessarily diagnosing and treating disease, but I can actually be somewhat of a lifestyle coach. I can be helping you guide your care through your primary care physician. Most of my patients do have primary care physicians, and they will come to me with their labs for a second opinion. Having your labs evaluated by a naturopathic physician, I believe, is a unique experience. Typically, what most patients have is they go get their blood drawn, annually for their physical, and they get a letter in their mail from their physician saying, this is high, this is low, this is what you need to do, and we'll see you next year. Often, what I often tell patients is that I want you to come back and talk to me about your labs, because we evaluate labs with what's called a functional medicine approach. So this means that we're looking for optimal health ranges. We're looking for numbers that are going to be consistent with what kinds of symptoms you're having, with how you're feeling. Patients often walk away from an appointment where we go over their labs so much more informed than they ever had been. Patients usually have no idea what's being run or why it's being run. And so I feel really passionate about helping you understand what we're running and what it means and how we can look at your adrenal function and your nutritional status, vitamin D, B12. So much can be learned from the standard numbers. Another thing that can be really helpful for patients is to get a second opinion. So say you went to your primary care physician or another doctor and you were given a diagnosis and you don't feel like you fully understand what you've been told or what that means or what your prognosis is, and I can really help you with that. I have a really strong history in women's health and a great passion for women's health, so I do a lot of patient education around pediatric care and women's health. On the women's health perspective, kind of a hot topic right now is HPV, or abnormal pap smears, which are being diagnosed every day around the world. And we're hearing more about cervical cancer as being a very serious thing, and it is in fact a serious thing. And typically what people experience is they're coming back with a abnormal pap and their doctors say, okay, we're going to do a wait and watch approach for the next 3 months. And that is one approach, and often women will clear the virus, but typically that will persist and often progress. What's great about the experiences that I've seen is that with implementation of herbs and certain nutraceuticals, vitamins, minerals, and diet, we can really improve the outcome. Very commonly, I see women's HPV clear with the implementation of some of these tools. So that's really exciting. No longer are women feeling completely freaked out when they hear they have an abnormal pap. I often reassure them that this is a great screening tool, and then there are things we can do to eliminate the virus that could cause the cancer. So I feel like that's a great service that I've had incredible success with. From a pediatric standpoint, guiding families with food introduction for babies, reducing allergies and eczema, and improving mood, reducing colic. See that all the time. Counseling patients around vaccination schedules and alternative vaccination schedules that aren't necessarily, where patients don't necessarily want to not give vaccinations, but they're not ready to give them the 48 vaccinations that kids are getting in 6 months. That's something I feel very passionately about, and I feel like I've been able to empower patients with a lot. So many patients experience heartburn, gas, bloating, diarrhea, constipation. They're getting diagnosed with IBS. Typically, their doctor says that there's not much they can do. They're given some pills for symptom management to control the diarrhea or to control the constipation, and they usually tell them it's stress-related. I have to say that, yes, there is often a mental emotional component, but 90% of these patients, when they clean up their diet, these symptoms go away. So that's kind of a no-brainer. And a really fun thing to be able to help patients with. All of the rates and logistics can be discussed with the front desk. So you can just call the clinic or email the clinic, and they'll get you going. Everything we do is electronically done, so all of your records are kept encrypted and safe within our electronic medical record system. And we can fax things back and forth and email things back and forth, and that's typically how that will look. Naturopaths are trained, as I mentioned, to get to the root of the cause, to really try to understand how people got to where they are, and start unpeeling those kind of layers, unpeeling the onion, so that we can kind of get to the core of that person, and making that connection that allows you to feel safe and comfortable in that process, and answering your questions, educating you, giving you the tools to kind of take your health into your own hands is really where I'm trying to take patients. So, and it's been very satisfying and really rewarding.